appreciate it. Love you too. Bye.
What's up, bro?
What's up, man? Hey, man, you know what's crazy? Like, ever since, like, my childhood, my mom always had me go on some errands for her. Especially since I'm driving now, she'd always have me go to CVS and pick up prescriptions. And with those prescriptions, it'd be like EpiPens, medications. And I believe most of the prescriptions are for her diabetes. And I don't know too much about that. Do you have anything, any information you know about it?
Yeah, man, I know a lot about diabetes. Want to hear about it?
Of course, yeah. Why not?
Well, I mean, there's two types of diabetes. There's type 1 diabetes, there's type 2 diabetes. Type 1 diabetes is a genetic affliction where the body's immune system attacks all the insulin-producing cells inside the pancreas. And type 2 diabetes is a condition that can arise during an individual's lifetime. It is not genetic.
Yeah.
You want to know more about like what type of diabetes you think your mom got?
Yeah, which type of which types are there?
It's just type 1, type 2.
Type 2. What's the difference? I believe it's possibly hereditary because my grandma also has it.
Yeah, type 1 is genetic. So it seems like your mom will have type 1 diabetes. If it's genetic, then well, really, if the pancreas is not producing insulin like it's supposed to, the body cannot get glucose. And I actually have something here that can show you what I'm talking about. So if your mom's pancreas is not producing insulin, which is represented by this little triangle,
Yeah.
then it cannot bind to the insulin receptor here. And when that doesn't happen, then all the glucose in the bloodstream cannot get into the cell. And glucose is the energy of the cell. So some symptoms she may like experience if she doesn't get her insulin shot,
Yeah.
then it could be extreme hunger because her body feels like it's not getting energy, drowsiness because the brain is not getting energy, and frequent urination because since there's so much glucose in the bloodstream, the body reacts by trying to urinate it out.
Yeah.
And also extreme thirst because she's urinating so much that she has to replace those liquids. And somebody with this is known as hyperglycemia, where there's so much sugar in the bloodstream, you may actually smell sweetness on their breath. And the opposite of that is hypoglycemia, where there's not enough sugar in the blood.
And with hyper and hypoglycemia, it seems that there's an issue with the glucose intake. So with people or patients who have diabetes, they would have to control and manage their diets and what they intake for nutrition.
Yes, exactly. People who are diabetic have to follow a very close dietary regimen to make sure that their blood glucose levels are not too high or too low.
Right.
And actually following a healthy diet is what can help you from getting type 2 diabetes, because the leading cause of type 2 diabetes is obesity. And I can demonstrate that to you here. So if there was type 2 diabetes going on, then we could have somebody who's become obese and they develop like fatty tissue over this receptor, and insulin can no longer bind, and this is called insulin resistance. And so the same thing will happen, the glucose cannot get into the cell. And there are two types of insulin resistance, where the body is not producing enough insulin, so not enough insulin receptors are being bound to, or the insulin receptors are not recognizing the insulin as insulin, or they cannot be accessed.
And with diabetes having so many symptoms, could the symptoms also extend to any other diseases related to diabetes?
Well, your lifespan can certainly be shortened with diabetes. It could probably lead to heart disease and other complications as well. Since the list of symptoms is so high, you could probably develop hypertension or tachycardia, which is hypertension is the increased blood pressure of the body, and then tachycardia is the increased rhythm of the heart.
And in the future, when I do have my own kids, would I have to per se just worry about anticipating possible diabetes in their.
Well, I hope that your family does not have to deal with any more type 1 diabetes, but the possibility is still there. So keep it in mind that you may have to plan on affording insulin shots, which can be quite expensive. Because the only way to treat type 1 diabetes is a healthy diet and insulin shots. Because type 1 diabetes, your body does not produce insulin. So, amen. A good time. I gotta head out to class, man.
All right, I'll see you soon, man.
See you later, bro.